Hello and welcome to our next episode of City Speak. I'm Clarence Anthony, your host and CEO and Executive Director of the National League of Cities. We're so excited today that we are recording this episode in May, which is Mental Health Awareness Month. Mental health is an important issue to all of us and is deeply intertwined with so many other issues that leaders are grappling with every day, from substance abuse to homelessness. And today we have an amazing guest from the Biden administration who's going to talk with us about some of these challenges. We're joined today by Tom Coderre, Acting Deputy Assistant Secretary of Mental Health and Substance Use in the Department of Health and Human Services. Welcome, Tom.
Thanks, Clarence. It's great to be with you today. And thank you to the National League of Cities for welcoming us on this podcast to talk a little bit about what we're doing to respond to the mental illness and addiction crisis in this country.
Wow, Tom, I have interviewed a number of people with long titles, including my own. But man, I think you got it. I mean, how do you introduce yourself?
I just say I'm Tom, and it's good to be here.
Well, congratulations on the award of the longest title that I've interviewed. I'm going to talk a little bit about, currently you lead SAMHSA, the Substance Abuse and Mental Health Services Administration, and HHS. And prior to your role was the agency's Region 1 administrator, directing all of the operations in Northeast part of America. But you also served as the National Field Director for Faces and Voices for Recovery, a leading advocacy organization for those that are needing for recovery services, and served in the Rhode Island Senate for 8 years. Man, you had a great career. Which one of those roles were your favorite role, though?
The next one, I guess is always my favorite one. I think may have had this experience too, Clarence, in your professional career. We really love the job we're in, and I've had so many amazing opportunities, but most of them, the ones at least that happened in my personal, after I achieved personal recovery from a substance use disorder, which I think we'll get into a little bit during the conversation today, those have been the most meaningful to me, because I've been able to really bring a lot of the previous experiences I had and blend them with my new life and recovery. And that perspective, I think, has really helped enrich each of those opportunities that I've had. I often say I have to pinch myself sometimes to make sure I'm not dreaming, because to go from being somebody who had lost everything to active addiction, and then to have these opportunities to work at the highest levels of government, it's truly an honor and a privilege.
Man, that it is an honor and a privilege. And I think that sometimes when you meet people and you ask them what is their why in terms of what they are doing and the impact it's going to have on others, that is an interesting question when you pose that question.
No, absolutely. And I think people in recovery really value story. There's really power in our stories, and each of us have gone through experiences and come out the other side, and now have these stories that really help point to the why, help point to the passion that we have for the work that we do. And I think that's an incredible way to be able to live your life. And what do they say? If you're doing something you're passionate about or you enjoy, you never work a day in your life.
That is true, but you need to get paid too. So I think being able to work makes a difference.
Well, no. What I'm saying, though, is if we get paid for the things that we enjoy, right, we never really truly work a day in our lives. I mean, some people, unfortunately, dread going to work every day. And
Yeah.
I don't have one of those jobs. I get up and I'm ready to tackle my job every day, because I'm getting the opportunity to give other people the same thing that I got, which is access to maybe to a treatment program, access to a network of people in recovery, access to recovery support services that help them sustain their recovery on a daily basis. When you are able to share those things with people and watch them grow and flourish the way you grew and flourished, it's really an amazing kind of life coming full circle.
I agree. So, there's a lot of acronyms in the federal government. And when people hear SAMHSA, they probably think of so many other things than a program that is providing services. Talk a little bit about the agency and the services it provide for people across America.
Sure. Well, SAMHSA stands for the Substance Abuse and Mental Health Services Administration. We are a health promoting, grant funding, and service delivery agency. Many people know us because of our fund, the funding that we provide, but we do so much more than that. We really provide leadership and voice to the field. We do practice improvement. We do regulation and standard setting. There's so much else that we do, and most people think that we're maybe some kind of private nonprofit, but we're really not. We're, as you mentioned at the top of the show, we're a division of the U.S. Department of Health and Human Services. There's 11 operational divisions. Most people know about the CDC or the FDA or CMS, but we are a small but mighty operational division as well, one of those 11. And our mission is to lead public health and service delivery efforts that promote mental health, prevent substance misuse, and provide treatments and supports to foster recovery. We want people that have or have been affected by or are at risk for some type of mental health or substance use condition to receive the care they need to achieve well-being and to thrive in their community. And at the heart of this work, we want to make sure we're ensuring equitable access to services and supports so that people have better outcomes. We've identified 5 key priority areas that better meet the behavioral health needs of individuals, communities, and service providers. And those 5 are preventing overdose, enhancing access to suicide prevention and crisis care, promoting resilience and emotional health for children, youth, and families, integrating behavioral health and physical health care, something we've been trying to do for a long time, and of course, strengthening the behavioral health workforce. Those are all big priorities for us and things that we think are challenges right now for our country. A prime example of this is our suicide prevention lifeline, which transitioned last July to 988, an easy to remember 3-digit number. The Biden-Harris administration has made an unprecedented investment, along with the help of Congress, of nearly $1 billion to support the 988 Suicide and Crisis Lifeline, including an initial $432 million to support its transition last year. We really needed to build up crisis center capacity and to provide special services, including a sub network for Spanish speakers. Additional funding for the 988 Lifeline has been provided by the American Rescue Plan, the Bipartisan Safer Communities Act, and the Consolidated Appropriations Act last year. Prior to these large investments, the Lifeline, which had existed since 2005 as that 1-800 number that people used to call, had long been underfunded. And as a result, we've had to do a lot of work with cities and local communities and big supporters, and have usually participated mostly with volunteers and kind of have stitched together local funding to fund these resources. Now we have this real vibrant lifeline called 988 that's funded with federal resources. And so we're really looking forward to continuing to build that out and to make sure that people have an easy 3-digit number to call, somebody to respond, and a place to go if they need help.
Well, thank you for sharing that. And the thing that is important in terms of your leadership is all of those are federal policies and programs that can be accessed by local governments, county governments, and others to assist individuals in cities, towns, and villages all over America. And the special thing about you and your leadership of these initiatives is that you have lived experience because you are in recovery right now. Talk a little bit about how your personal journey has influenced how you are leading and the impact that you'd like to have on the role that you are in.
Sure. No, thank you for the opportunity to do that, Clarence. I came from a good, loving family, and I had many friends by the time I was 30 years old. I was working in nonprofit management and development and had a love for politics. As you talked about, I was an elected member of the Rhode Island State Senate when I was just 25 years old. And, on the outside, everything about my life looked normal. Some would even say perfect. But on the inside, I was tortured. I was having a lot of difficulties. And so I turned first to alcohol and then to other drugs to cope with the stresses that I was experiencing. I was underestimating the power of those substances. I really didn't understand the neurological consequences of taking them. And so I quickly became addicted. And my life started this downward spiral. As my life began to unravel, I started to lose the things that were most important to me. When my family and friends tried to help me, I pushed them away, resisted their help. That caused me to lose them. I ended up losing interest in politics eventually, lost my job at that nonprofit and my position in the Senate. My health deteriorated. I lost my apartment and I became homeless. I lost my spirit. I lost my freedom. And in the end, I lost everything, even my desire to live. And so my life, which at one time was so full of hope, became hopeless. And fortunately, my story doesn't end there, as you know, because I'm here on this podcast with you. I was able to get the help that I needed. And today I'm a person in long term recovery, which for me means I haven't used alcohol or drugs. And I've been dealing with my mental health conditions since May 15th of 2003. So last week I celebrated 20 years on this journey. And it's just been an incredible blessing for me. And I know that's probably odd for me to say it's a blessing to have gone through all of that. But it's really given me an opportunity, as you just alluded to in your question, to bring a different perspective to this work. Of course, we have a lot of qualified people who work at SAMHSA who have advanced degrees, who've gone to school for a long time, who've done a lot of research, who have been in practice in local communities around this country, and I'm grateful for all of those folks. But bringing the voice of lived experience into this process really helps inform it in a way that it hadn't been informed before. And there's, a lot of my friends in recovery, when they found out I was going to work at SAMHSA, had a lot of advice for me and, and asked me to bring some of their concerns to the federal government. But what I've been able to do mostly since arriving uh, back at SAMHSA is set up an office of recovery, where now we have 10 people who are watching out for all of our notice of funding opportunities, that are reading all of our publications and documents, that are sitting on cross agency work groups, that are around the tables with all of those other professionals and folks who have really been at the top of their careers, but they're getting informed now and getting opinions from people with that lived experience. And I think that's just making us a better agency. It's making our programming really be more culturally competent, and it's helping us meet people where they are on the ground all over this nation, and no matter what community you live in.
Well, Tom, yeah, well, I got to tell you, I really appreciate you sharing that story and me knowing that you're there. The impact that it has, not just on the individual, but the family. Well, I remember probably in fourth grade when every Saturday morning I'd look out the door and there's my dad in the car drunk.
Mm.
and eventually he disappeared. And I look back in graduation from high school, in the theater department, awards, and he was never there. But he was homeless
Mm.
on the streets. And we would bring him back home and help him, but he could never kick the demon, if you will, and the challenge that he had. But the more I get educated and the more I hear about your story and others' stories, I have hope that others, family members, will be able to help their family members through this because it has long term impacts on so many others that are around you as well.
Oh, absolutely. And thank you, Clarence, for sharing. That's a very personal story that you shared. And unfortunately, your dad wasn't able to find recovery. And I wonder if we had done a better job of engaging, with engagement tools, that we could have reached him. My story that I shared with you is not unique, though. It's the story of 27 million people in America, and tens of millions more who have recovered from mental health conditions as well. It really is more and more prevalent than people think, that there are a lot of people in recovery. But the hard truth is that there's tens of millions more that are struggling right now as we're taping this podcast. And how do we reach them? Like, how do we do a better job of working with families and giving them the tools that they need? How do we work with those individuals to bring them across what we call the stages of change? So somebody goes from a pre-contemplative state to a contemplative state to taking some action, positive action in their lives. And how do we support those individuals along across the lifetime? I mentioned one of our priorities is that physical health and behavioral health integration. When somebody goes to see a primary care doctor, is that primary care doctor trained to help recognize the signs of a substance use disorder or a mental illness, and then do the proper referral for that individual? Do we have enough programs out there for folks? These are the things that keep us up at night at SAMHSA every day.
Thank you for that. And I'll also say, use the term keeping us up at night. About 6 years ago, and I was going around America speaking, and I get the local newspaper everywhere I go. And I'm from Florida, started there. And so, South Florida, I started seeing all of these articles about opioids and deaths. And then Northeast, which was really around a lot of communities, and then the Midwest. And I came back to my staff and I said, I think we have a major issue, a big issue here in America. And so, most recently, I've started seeing the issue of fentanyl, and it's a much stronger drug entering the conversation. You've been working to help coordinate the federal government strategy to combat opioid epidemic and reduce overdose. Talk to me a little bit about what's going on and the resources that SAMHSA has available to help city leaders to address these challenges because it ends up in communities, cities, towns, and villages, neighborhoods, county facilities. We've identified the issue. Tom, what can we do? And are you seeing the data around opioids and fentanyl increase?
Absolutely, and the loss of life through overdose in this country has been truly horrific, and our hearts go out to every family who's lost a loved one to this uh, epidemic. But President Biden has addressed this head on in his national drug control strategy. He's really prioritized the battle against overdose and substance use. Secretary Becerra, our secretary at HHS, has also prioritized this and released an overdose prevention strategy comprising of 4 pillars: primary prevention, harm reduction, evidence based treatment, and recovery services. Our assistant secretary, Dr. Miriam Delphin Rittman, who when she came to SAMHSA, listed as one of her near-term strategic priorities, preventing overdose. So this is like an all-hands-on-deck moment for us in the federal government. During the pandemic, we made we were able to have flexibilities and to allow for folks to receive treatment through telehealth. We're working to make those things permanent right now. In a couple weeks ago, we had the expiration of the public health emergency, and SAMHSA and DEA proposed a temporary rule that extends the full set of telemedicine flexibilities adopted during the public health emergency for 6 months. So that's going to be, people will still be able to access those through November 11th of this year. And why is that important? Well, it's important because so many people who have been struggling with opioid use disorder, the most effective treatment for that is medications for opioid use disorder, or medication-assisted treatment, as some people refer to it. And so to be able to receive that in an easy way, right, without barriers, I think is really, really important. And complementing those policies are billions of dollars in funding that SAMHSA has received, which we in turn turn around and put right back into states and local communities every year to expand access to treatment and supports for people. For example, last year in September, HHS through SAMHSA and our sister agency, the Health Resources Services Administration, HRSA, awarded more than 1.6 billion dollars for communities throughout the country addressing the addiction and overdose crisis. We at SAMHSA have our state opioid response program and our tribal opioid response program that constituted the lion's share of that funding. Our SOAR program addresses the nation's opioid and overdose crisis by providing resources to states, territories, and that all flows down to local communities, the folks that you guys represent, for increasing access to those FDA-approved medications I talked about for the treatment of opioid use disorder, as well as supporting the full continuum of services that people need, from treatment right to long-term recovery. And then we have a tribal program that does the same exact thing. You've also likely heard about the FDA recently approving the over-the-counter sale of naloxone, the opioid overdose reversing medication. And we applaud this latest step in accessing this life-saving medication. We've been putting it out on every street corner we can for many years now, but to have this available in every pharmacy around the country over the counter, we think is going to be a game changer. We also provide technical assistance and training to healthcare professionals who are in a position, like I said earlier, to screen, to provide substance use disorder treatment. Back when the Consolidated Appropriations Act passed, Congress passed two really important measures as part of the budget this year. One was called the MAT Act, the Mainstreaming Addiction Treatment Act, which removed the waiver requirement for physicians to be able to prescribe buprenorphine, which is really, really important. And then there was a companion act called MATE Act, and the MATE Act was the education component to try to make sure that all doctors, anyone who has a DEA license to prescribe controlled substances, has to have at least 8 hours worth of education on substance use disorder. We think this is really important too. Most doctors don't receive training in medical schools about this. And so having a way to get folks continuing education so that they know the signs and the symptoms, as well as some of the treatment options, we think is going to be an important step to help really turn the tide on this epidemic that is, like you said, started many years ago and is just gotten worse. We lost 107,000 Americans last year to a drug overdose. That's not acceptable, and we need to do better to try to get our arms around this and try to save lives.
Yeah, and I agree with that. I mean, this is not just an adult challenge and issue. It's impacting our youth. It's not just an urban and rural challenge. It's a suburban challenge. It's our white population when the opioids in the suburban and then urban. I mean, it's America's issue right now. And I said this before, we're lucky to have you in this role because when we get in the bubble of Washington, D.C., we started talking about these issues. That's what our local leaders are here to help you to address some of these challenges. So please know we want to be a partner. You know, as you talked about all of the programs, the initiatives, and you talked about the doctors needing training, is there a challenge or a shortage for behavioral health practitioners to address these issues we're having? And what are you doing if there are challenges?
Yeah, that's a great question. We actually have a huge shortage in people delivering behavioral health services in our country right now. In fact, this is probably the thing I hear more than anything else. That we had a crisis of epic proportions prior to the pandemic, right? Of people needing mental health services, people needing addiction services. COVID exacerbated it all, right? Increased substance use, we know in America's communities. We know that other behavioral health conditions like anxiety, depression, other more mild and moderate conditions increased, especially in youth. And so people started seeking treatment. People started reaching out, and what did they find? They found that there were these huge waiting lists to be able to get access to a behavioral health provider. The nation's workforce of mental health and SUD treatment professionals is really critical to providing access to those essential healthcare services. Recognizing that a strong behavioral health workforce is critical to providing services that meet people where they are. SAMHSA works with states and other stakeholders to develop and support recruitment and retention efforts specific to addressing mental health conditions and substance use disorder. Some of those resources I talked about earlier that we're getting out to communities, billions of dollars, uh, are being used to help recruit and incentivize people to stay in this field. SAMHSA has some authority in this area, but we really have to partner with our sister agency, HRSA, that I mentioned earlier, and others, the Department of Labor, and other folks around the government to accomplish these goals. We provide numerous pathways also, such as training and technical assistance. We are expanding the use of paraprofessionals and focusing on increased diversity and cultural competency. Additionally, peer counselors and paraprofessionals have really shown to play a crucial role in extending care to communities. So we are trying to increase the peer workforce as a way of, you can bring peers on fairly quickly, minimal amount of training and supervision, and they can use their lived experience to help people navigate these complex systems and serve in some cases serve as a gap between, to help fill the gap between the time somebody needs care and they get it. In other cases, even just provide the support that person needs, locate other resources in a community to help people if they can't access a psychiatrist or healthcare professional that they need to see right away. Maybe they can be connected with other levels of care that help bridge the gap until they get to see that professional that they need to. So we're doing as much as we can. We feel sometimes, Clarence, quite frankly, that we're drinking from fire hoses on all sides. So anything that folks in local communities can do to help us get attention to these issues, we really, really appreciate.
Yeah, I can tell you that everything you talked about during the COVID, a lot of our local leaders saw it on the ground. In fact, because we saw it in our local leaders, we actually, as the National League of Cities, promoted and asked our members to develop mental health approaches to manage within their own workforce.
Right.
And we explored and promoted a mental health challenge to
Nice.
our city leaders and other associations in Washington, D.C. So we recognize the role of local government in getting funding and support. I think if you had anything that you would want the National League of Cities to do and other local leaders to do, what would that look like in terms of a partnership?
Well, first, what you just said about the mental health challenge that you encouraged local communities to take. I want to thank you for that. I think, as I mentioned about my personal experience and about the staff at SAMHSA that have lived experience and are walking our own recoveries. When we do that, it reinforces for how important it is for leaders to be an example to others. When you encourage local communities to take that challenge and show that their own mental health was just as important. We saw large rates of burnout during COVID, and
Mhm.
people were really just taking in way too much. So first and foremost, I think that is an important thing that local leaders can do. Talk openly about their struggles. It really helps normalize the conversations. Um, I mentioned uh, earlier that so much of what we do is helping Americans to have an open dialogue in this area. It helps them to relate to each other and to facilitate discussions about the decisions that are necessary to be made in local communities. And having that supported language and shared testimonies and the stories that we talked about are how powerful those are. These are things that help leaders model and make it easier to know that it's okay to reach out for help and to share that they're struggling and that they need help. So we stand with everyone that's impacted by whether it's an addiction or a mental health condition, so that more people can begin their journeys and experience the promise and joy of recovery. We want to make sure that local leaders have the resources they need. So if folks need help navigating any of the federal resources, we stand ready to help them. Many local leaders have set up, whether it be task forces or local committees, to help identify and do assessments in local communities of what their needs are and find out where the gaps are. We can then help find resources to fill in some of those gaps. So we really think that it's important for them to come to the table, to communicate. We try to make ourselves available as much as possible to have those conversations with local leaders, and we want to continue to be able to do that.
Well, Tom, thank you so much for being here and sharing with
You're
us
welcome.
what the work that SAMHSA is doing. To our listeners, again, May is Mental Health Awareness Month.
Oh, I wanted to share something about that too. Am I able to?
Go for it.
So we actually rang in Mental Health Awareness Month with a new online resource that can help people as they begin their search for help and supports. Many people are aware of SAMHSA's treatment locators. We have these online sites and phone numbers that people can call, and if they need treatment, which is great. But a lot of people said, we need something that helps me even before that. Like, I don't even know what kind of treatment to look for. I don't even know that I need treatment. What can you offer me before that? So, as people begin their search for help and supports, we developed something called findsupport.gov. And we'd love your listeners to go to findsupport.gov and check it out. Similarly, if people already know they're looking for treatment, they can use the treatment locator at findtreatment.gov or the 1-800-662 helpline. But this other tool really guides somebody through the journey of seeking treatment. Like, what's the first step? What's the second step? It's very, and it kind of meets somebody where they are and kind of has a kind of continuum where if you're looking for this, it sends you in this direction to ask a certain set of questions. If you're looking for something else, it'll send you down that path, so that you really feel like you're supported on the journey. So findsupport.gov is a great tool. And of course, if anyone is in crisis, they should call our 988 helpline. You can dial 988, the 3-digit number, or you can chat at 988lifeline.org. And there's also a texting feature that's available. We know a lot of I've got 6 nieces and nephews. I don't know. and I very rarely talk to them on the phone. They are always texting me. So young people can also text to 988 as well.
Well, again, City Speak has just been honored to have you, Tom. Tom Coderre, Acting Deputy Assistant Secretary for Mental Health and Substance Abuse in the Department of Health and Human Services, the man with the longest title in America, but also the person with some of the greatest resources that America needs right now. And I will tell you that the challenges of mental health in America needs to be focused on. We're lifting it up with our members at the National League of Cities. And finally, I just want to say to you, it has been such an honor to meet you. I've learned so much. It's brought back memories in my personal life. And I hope that people will listen to you and access the services that you have been talking about that you're providing at SAMHSA. You're making an impact, and I want you to know that we appreciate you.
Well, thank you, Clarence Anthony, and to the National League for allowing us to come on and be able to talk with you about what we're doing and to ask for your help. We can't do this alone. We would want to do it alone. It's much better having partners like you guys to get this message out.
Consider us a partner.
Thank you.
Thank you, Tom.
Thank you.
Thanks for listening to City Speak with Clarence Anthony. If you like this show, let us know. Share this episode with your friends and make sure to subscribe. We're curious to hear what you think, what you want more of, and how we can improve. If you have feedback or an idea for a guest you'd like Clarence to sit down with, send us your thoughts at cityspeakpodcast@nlc.org. Join us next month for a new episode. Like and subscribe here or wherever you get your podcasts. See you next time.